If you're unfamiliar with NEBDAC, let me just give you a quick background. Since 2016, NEBDAC has been a collaborative effort between the NEHA, Hemophilia Alliance of Maine, and Connecticut Hemophilia Society. So this is year 5 for us, and we're very excited about the work we've done. Our mission statement shared here is really to empower our community with tools, training, and resources to become an effective network that will champion bleeding disorder quality of life through the New England states. The NEBDAC roles. So in this coalition, we have different sets of roles. NEHA serves as the direct contact and the manager of this initiative, but the directors from all 3 chapters in New England serve as a cooperative support system. You'll hear me refer to state leads, and those are folks in each state in New England who are our point of contact, our leaders for our advocacy efforts. They're encouraged to recruit new volunteers and be the contact person for all of our legislative advocacy activities. Ambassadors are community members like yourself who opt in and agree to help out when an action alert goes out, attend local advocacy events, and contact their legislators when we need to move forward legislation or policy. So if you're unfamiliar with who your state lead is, here's a list. Connecticut and Massachusetts, we have 2 state leads. In Maine, New Hampshire, Rhode Island, and Vermont, we have just 1, but we would be happy to have 2 state leads in all of our New England states. If you are thinking you would like to get more involved, maybe you're already an ambassador, reach out to your other state lead if you think you'd like to take on more of a role or responsibility. If you have not signed up to be an ambassador, I'll talk a little bit about that. We would love to have you join to be a NEBDAC ambassador in New England. So what do we do? NEBDAC monitors and responds to law and policy changes in New England. We bring recognition to the community. That can often be through our proclamations or resolutions every year for Bleeding Disorders Awareness Month. We try to tackle the big issues that you hear about through the year. Those can include step therapy, accumulator adjusters, 1115 demonstration waivers, pharmacy and therapeutics and drug utilization review committees we monitor, and other insurance changes that might not be laws, but might just be a policy change. And I'll talk a little bit more about that. If you don't know, we do have a NEBDAC website. It's nebdac.org, so it's really easy to find. You'll see new content and posts on there every month. Contact information if you want to get in touch with myself, Rich, or any of the state leads. It's a place for interaction and engagement. And if you are not an ambassador and you're thinking you want to sign up today, there's a really easy place right on the webpage to do that. We also launched the NEBDAC monthly newsletter. So the first Friday of every month, if you've signed up, you'll receive NEBDAC notes, which keeps you up to date on the advocacy issues that month. Bleeding Disorders Awareness Month is one of the things that NEBDAC does every year, and you'll usually see information about this. March is Bleeding Disorders Awareness Month, and we try to get a proclamation or a resolution or both in each of those New England states. And what those are is a proclamation would be where the governor basically signs an executive order that says we're going to recognize March as Bleeding Disorders Awareness Month. A resolution is very similar, but it's done in the legislature. So your state legislature would pass a law that basically recognizes Bleeding Disorders Awareness Month as March of that year. NEBDAC leads that every single year. You might have been involved. We also try to have a state legislative day, sometimes around that time, sometimes later, to also get folks into their state capitals and meet with legislators and sometimes the governor as well. So this year was quite a busy year. Not only did we have a pandemic, but we had quite a few advocacy issues. If you haven't been paying attention to our newsletter, I just want to give you an overview of a couple of things that NEBDAC worked on. The Hemophilia SNF Access Act was a very important advocacy issue that we championed at our Washington Days in 2020. And it takes effect this month, so it's very exciting. And basically, there were some mechanisms that meant folks with bleeding disorders were unlikely to be able to receive treatment in a skilled nursing facility to do rehab. That was very hard because it meant that bleeding disorder patients would have to try to get those therapies elsewhere and cobble together other services. So that was our big ask at Washington Days in 2020, and that takes effect this month. Very exciting. NEBDAC tried to keep the New England community apprised of the special enrollment period. So over 2021, you really had lots of options to maintain or obtain new health insurance over the past year. We plan on doing that next year because these special enrollment periods, these times when you can sign up for the federal marketplace health insurance plans, is less and less kind of a standard time frame. So we'll keep you informed about that. Also, one of the things was we got involved in advocacy around the Department of Health and Human Services reading of the non-discrimination provisions. Basically, the federal government had taken a more restrictive view of how to review cases for discrimination. The administration is now taking a broader view, which means more cases could come through for folks being discriminated against on their healthcare plan. So that was a good thing this year as well. Washington Days in 2022, I think we'll be making announcements soon. NEBDAC participated in Washington Days in 2021. We had representatives from all of our 6 New England states, and we talked to most of our federal legislators and senators about the importance of continued funding for the CDC, the NIH, and HRSA. All these programs really do different things, but all support the bleeding disorders community. Again, we did proclamations and resolutions in 2021. We will do that in 2022. If you haven't participated in that process before, becoming an ambassador is a great way to participate. If you are just interested in what that does, you can check out our website or feel free to email me. One of the big issues that we worked on this year as NEBDAC was accumulator adjusters. Accumulator adjusters is a practice of eliminating or not acknowledging payment assistance programs. So patients that have some kind of assistance program, that really helps out. There's these insurance practices that now might either not acknowledge or simply disregard those payment assistance resources. So what we're trying to do is promote state laws that ban that practice. Connecticut had a big success this year, became the 11th state, and I think there's more now, it might be 13, that ban that practice. Our state leads in Connecticut, Jennifer and Alyssa, did a lot of work around that. Rhode Island, we made a lot of progress in putting bills promoting bills that were in. They didn't make it through, but we are going to probably try again this next coming session. And in Massachusetts, there are currently bills to ban this practice. So NEBDAC not only advocates for these issues, but we keep you informed of how far along, how successful we are. One of the things that you will see is an advocacy alert. So if we get to the point where we need votes to get this to come out of committee, or votes to get this to the governor's desk, or votes to get the governor to sign it, we send out an advocacy alert, and we're asking you to participate by emailing, calling, texting, tweeting to say, hey, our community wants this. We're trying to gather support. Step therapy, similarly, is a harmful tool that insurers use to basically require patients to fail first on a medication before getting to a medication that they will pay for. You probably have heard about step therapy. We've been talking about it in the community for a couple of years now. We joined with 41 other patient advocacy organizations to support step therapy bills that will help patients not have to go through that practice. Massachusetts in particular has step therapy bills that we are monitoring and will ask for your help with to try to get those over the finish line. We joined efforts with the Patients for Prescription Access Coalition, and that's really being led by Rich and doing an amazing job. This is a new coalition that helps track these bills across New England. In addition to the NEBDAC website, the Patients for Prescription Access website is wonderful if you want to stay up to date with what's happening. We have been promoting the establishment of rare disease advisory councils across New England. Maine had a bill that has been carried over and might be the newest state to have a rare disease council. These councils are put together and not only advise the governor or maybe the commissioner of Health and Human Services, the CDC, or other executive branch departments, but they are meant to put together education materials every year for communities to see how rare disease patients are impacted by state government. Really important. We would like for all 6 New England states to have a rare disease advisory council. And then we just do other things that are not legal in nature. They're more policy in nature. The Maine Bureau of Insurance is a really good example of something we did this year. They were proposing a standardized health plan model that would just have co-payments rather than co-insurance. We reached out to them, we wrote a letter to them and joined with other patient advocacy groups to talk about how co-payments rather than co-insurance would impact the bleeding disorder community because of such high costs, usually at the beginning of the year. So it wasn't a law, but it was a policy change that not only did we monitor, but we wanted to get involved with. I do want to make some time for our state leads and also answer some questions. I know that Nick McRae and Mike Dowling are on the call. If we have another state lead on the call, would love for you to pop in as well. Maybe Mike Dowling, would you like to share your experience as a state lead quickly and encourage any others to become an ambassador who are not?
Yes. I mean, I found it interesting here, just trying to keep track of different legislative initiatives in Vermont. One thing that I was involved with just this week was our drug utilization board. And basically it's a panel made up of approximately 24 doctors and pharmacists in Vermont that decide which hemophilia medications are going to be on their preferred list versus their non-preferred. And Medicare uses this to determine which medicines to pay for, as do all the insurance companies. So, and I actually heard from afterward my treatment center who said that they'd been having trouble trying to get insurance coverage for patients on a new factor 9 product. And now the state of Vermont, this board specifically, has gone ahead and moved that from their non-preferred list over to their preferred list. So I think even though I didn't speak the other night to this panel, I think they knew who I was. They knew I was on the call. And I think it certainly helps to have the constituents showing interest in the process and for them to see that people are truly interested and have a vested interest in looking out for these kinds of things, just so we have greater access to more products here in Vermont. So I think there's lots of different ways people can become involved, and I would encourage you to look into it.
Thank you so much, Mike. Nick, are you still on?
Yes, I'm on.
Nick, do you want to share a little bit about your experience as a state lead?
Yeah, so I'm up in Maine, and we get to do some pretty cool things. Like Mike was saying, we also just had our drug utilization review board, which focused on all the hemophilia medications and coverage just a week or two ago. We've also had opportunities to meet with our national senators and representatives and kind of talk to them about what it's like to have hemophilia or a bleeding disorder and other rare diseases and some of the challenges we're facing. I've also been getting to know my local reps and senators and kind of doing a lot of different really cool things. But also even just the smaller things like letting people know that if you're on the federal marketplace in Maine, we now have a state marketplace that's opening up in about 2 weeks, and that people will be able to get their insurance that way. So just those little things that are really interesting that we get to find out and help make people aware of and get people involved and kind of letting the state know what our needs are and some of the things that they might think are good ideas might not always be so good for us and letting them know that because a lot of times they just don't even realize as they're making these laws. So it's definitely a great way to get involved. And if anyone's interested, I think even just being or being in a ambassador is really great because you get to know these things and you get to help out. And it's not a ton of work or a ton of time, but it's definitely a way to get involved and learn a lot more about the community, I think.
Thank you so much, Nick. Yeah, so Nick and Mike Dowling are state leads. They volunteer a lot of time throughout the year. We have a monthly call and we review new and important issues that are popping up that could impact the bleeding disorder community. That call is with not only our chapter directors, but with NHF and HFA. And so we really stay on top of policy issues throughout the year. And that also means that if you see something that you have questions about or you're concerned about, not only can you reach out to NEBDAC, but you can reach out to your state lead because they probably have some up-to-date info on what's happening. So thank you so much to Nick and Mike and our other state leads. Again, I just want to say, if you're interested, check out the website, make sure to read our newsletter, sign up to be an ambassador. And with that, I will take some questions because I know we're at time. Here is my email if anybody wants to reach out. Even if you're just curious about like, how much time would I commit as an ambassador, that's fine.
I just want to jump in and say thank you, Joe. Thank you, Joe, and to the state leads for so much goes on behind the scenes. Sometimes you don't see all of the action alerts because we can't send an action alert out for everything that's happening because so many times it's complex where you start with the introduction of a bill, then it goes to committees, sometimes joint committees, then it has to go to another committee, then it has to go to a vote. So that's where it's so important to have ambassadors signed up to help out with some of the stuff behind the scenes. Usually when there's an action alert, it's already gone through multiple process of steps of that final push. So if you're not signed up for an ambassador just yet or have an interest in advocacy related materials, there's a lot happening here in New England. And as Joe mentioned, not only do we have the accumulator adjusters for those in Massachusetts, we also have the pending, yet again, sunset provision for coupon assistance, which expires January 1st of 2023. So yet again, we will be advocating for hopefully a permanent solution to this, if not a 2-year, another band-aid, so to speak, but at least it gets us through on the short term. So is there any questions for Joe or for the state leads?